So, dear students, we have to start. And today we're going to talk about crowns, about artificial crowns in prosthodontics, and we're gonna talk about what the difference between crowns, which kind of crowns prosthodontics using nowadays, and how to create them, how to use them, and which difference between all of them. So I have to be sure you can see me, you can hear me very well. So today's topic of the lecture is indications and clinical and technological stages of manufacturing artificial crowns. So fixed prosthetics are very popular because with the loss of individual teeth, this method allows relatively inexpensive and very effective restorations of the denture and which in the normal function and appearance of denture. Modern technologies functionally expanded not only indications for permanent prosthetics, but also allowed to apply completely different methods of restoration, loss and defect of teeth. For example, the method of repair to defect with artificial crowns. An artificial crown is called a prosthesis, which is supermost of the natural crown of the tooth and completely covers it. Crowns can be made of metal, plastics, porcelain, or combinate metal and plastic or metal and porcelain, or just porcelain. The hardness of these materials is different, and it is sometimes possible to compensate for the lack of hardness by increasing the thickness of the material. Accordingly, in the manufacture of the crown, the tooth preparation technique has its own characteristics, which must be taken into account for the qualitative prosthetics. The first one, crown, I want to show you is the plastic crown. It's a temporary one crown. That's kind of prosthetic of the crown using almost everywhere, and usually such a crown can be used in different situation when you have to remake one tooth or few teeth, and when you have to rebuild all the teeth of the jaw, temporary, because nowadays prosthetic crowns we are prosthodontists using just for as a temporary crowns. For example, during the period when soft tissues are gonna heal after surgery or therapeutic treatment. But this is not only one method, and plastic temporary crowns can be used when, for example, when you're doing endo treatments to prepare teeth for metalloceramic crowns or porcelain crowns or zirconium crowns also. So this is a very popular kind of crowns, and you have to understand, you have to remember that crowns can change colors because of food. That's a kind of these plastic crowns. These plastic crowns can be broken because of biting something or just biting, and it's not very strong kind of crowns. That's why better to use it just as a temporary one. And you have to remember, for example, when you're doing soft tissue augmentation with around the teeth, and to prepare teeth for porcelain crowns or veneers also, and you need to get more gum around the teeth. Better to use such a kind of crowns, plastic crowns, and patient can use it during 1 month, 2 months, 3 months, even 6 months, and it's gonna be fine. It's gonna be okay. Next one. Okay, next slide is about these plastic crowns. Indications for orthopedic treatment with plastic crowns. Defects in the crown part of the frontal teeth. Anomalies in the form, size, position of the teeth. With small defects included. As a provisional crown for the period of manufacture of metal, ceramic, cast iron, and porcelain crowns. Contraindications to orthopedic treatment with plastic crowns. Deep, incisive overlap. Allergic to plastic. Low and wide clinical crowns of the tooth, abnormal imposition of the teeth, bruxism, absence of lateral teeth, elevate contraindication, and defects in the lateral parts of the dentition, especially first and second classes, according to Kennedy, related contraindication. So, what does it mean? You cannot use such kind of crowns with when you have situations, clinical situations like deep incisive overlap. Deep incisive overlap. What does it mean? It's mean when patient gonna bite, that plastic crowns gonna be broke. Allergic to plastic. It's clear. Allergic to plastic. It's mean you cannot use such a material, even temporary, even for one or couple days, because you can get easily very difficult allergical situation, and it's gonna make your relationship with your patient very difficult. So, and later you have to think about treatment of that allergy. And of course, and at the same time, you have to change the plastic crowns for something else. Okay, let's continue. Low and wide clinical crown of the tooth. Long and wide clinical crown of the tooth. Long and wide. It's mean deep inside, because material, the plastic, with plastic, yes, material, not gonna be very, not gonna be white as we're waiting for this. So it's plastic as a plastic. It's not a natural. It's doesn't look like a natural. And if your patient has situation with the teeth like low and wide clinical crown, the plastic temporary crowns are not going to be good for such clinical situation, and better to use something else, maybe composite. Okay. The next one is abnormal imposition of the teeth. Bruxism. Bruxism. What is bruxism? Bruxism is a condition when your patient moving and biting and cannot control this condition, especially at night. Yes, with a special noise. And biting and doing like this. Clinicians, dentists, calling it bruxism. It's usually that condition is that happened because of problems with nervous system, stresses also, and when patients tired and then with another diseases of nervous systems, and defects in the lateral parts of the dentition, especially first and second classes, according to Kennedy. Okay, the next page is about one piece crown. This is a metal crown which is made of cobalt chromium, a lot of the modern method of solid casting. Actually, even 10 years ago, here in Ukraine, it was a still a very famous method of prosthetics for prosthodontics, but the first, the first I want to say is about look at this picture. It's a metallic crown, and of course, I have to say that such a crown you can use only only when you want to cover premolars and molars, only molars actually, because if your patient gonna smile, of course, everyone can see such a huge color of such a horrible color, even not huge, and huge defect of the metal crown. Of course, if you're talking about aesthetic, it's not gonna work. But if you're gonna talk about function, this crown gonna work very well because it's very strong material, and when we want to cover defects, um, by the way, we didn't talk about defects and when we have to place such a kind of crowns. For example, deep caries cavities, fracture of the clinical crown of the teeth. Uh, what else? Mm, trauma. Uh, Complications of the caries like pulpitis, periodontitis, which gonna broke and gonna destroy clinical crown of patients later. And when we wanna rebuild, remake clinical crowns, of course, um, we can use composite materials, but composite materials is not a good one method when you have to remake more than 50% of the clinical crown. And if you're talking about molars, like on the picture, um, if you want to rebuild clinical crowns and your composite materials gonna consist of more than 50%, it always have to be covered by crown. And this one-piece crown is not a bad one method, not aesthetic, but very functional. Okay, stamp crowns. Stamped crowns was a very famous method of prosthetics even 15 or 20 years ago in Ukraine, and I have to explain you why. What is this actually? This is the thin walled cap fitted anatomically to this crown of the tooth. Its thickness is only 2 or 3 millimeter, 0.2, 0.3 millimeter, made of half crown gold or nickel chrome alloy. Um, okay, let's talk about material. If such a crown were made of the gold, it's not a bad kind of treatment. It was actually very well kind of treatment, which have like a lot of mm, good things and bad things. Let's talk about goods. Okay, gold is a very good material. If you're talking about biological, you can never find any inflammation of soft tissues around gold crowns if you're talking about gum. But it's a very soft material, and later, in few years, in 5, 7, 10 years of using such a gold crowns, but look at this picture, it's metallic stamp crowns, not gold, and when you're using patient using these crowns, biting on it, later this material, because it's soft, gonna broke. And when you're checking on it in 10 or 15 years of using, you can find windows, like holes in that crowns because of biting, and you have to change that crowns, of course. But if you're gonna look at soft tissues around the teeth, you can never find any inflammation, any uh, bleeding of the gum. And the patient usually not complaining that kind of crowns, but it's only this all of I was talking about. It's only about gold crowns. Um, if we're gonna talk about these nickel chrome crowns, stamped crowns, well, it has a lot of bad things, more than good things. What I want to say? Why people and doctors use such crowns and prefer such crowns? First of all, because they're cheap. The price almost nothing, because this is a very cheap material, and um, in laboratory it was very easy to make them, and for doctor it was very easy to place them in the oral cavity to cover tooth or teeth, and I want to say more about bad things about the crowns. Look at the form of it. It's on the picture here. Actually, is a very nice form. Usually, such crowns looks very horrible, because they are not that anatomy form like it should be, like a crown should be. They're just simple one, simple. And when doctors gluing, placing on the tooth, gluing the kind of crowns, um, the form the form of that crowns are not very well, and you can make pressure on soft tissues around the teeth to make them bleeding later, to get inflammation later, to get a lot of granulate tissues around it, bad smell, and all of this gonna make first gonna make pocket gums, later gonna make pocket in bone around the teeth, and later what we can see moving of the teeth. Yes, moving, because bone around the teeth are gonna resorb. Why? Because that kind of prosthetics are not very well. They are not natural. They are not biological, and later people usually losing their teeth because of not very well um, made crowns, like stamped crowns. So I recommend you not using such a method with stamped crowns nowadays, because nowadays we have a lot of um, good techniques of prosthetics, uh, like zirconium crowns, like Emax crowns, porcelain crowns, also, and even metal ceramic crowns. Okay, but to know the history, you have to know about such crowns, such a method. Stamped crown. The stamped crown is a thin walled cap fitted anatomically to the crown of the tooth. Its thickness is only 0.2-0.3 millimeter, made of gold or nickel chrome alloy. Indication: restoration of the crown part of the tooth for various defects. It is a supporting element in the design of the bridge, to protect the tooth if it was chosen as a support for the class of the class. Prosthetics. This prosthetic is used in children's practice. Ready-made crowns made of them stainless steel for temporary teeth or firm DMSF. Advantages: minimal teeth grinding. Preparation for the stamped crown is carried out very sparingly. The shape of the stamp is obtained clinician on only 0.2, 0.3 millimeters or 4. What I want to say: this is the only one kind of crown, these stamped crowns, when you have to uh, prepare the teeth before impressions. Not too much prepared. Um, 0.2, 0.3, it's almost nothing. When we want to place metalloceramic crowns, we want to place one-piece crown. When we want to place zirconium crowns, we have to prepare one zero five 1.5 millimeter, even 2 millimeters of them tissues of them of the tooth, and it's too much. It's too much. But when we're using these methods, these stamped crowns, we can prepare just 0.2, 0.3 millimeters, and it's going to be enough for impressions because that material is very, very thin. Okay, possibility of prosthetics allow clinical crowns, where modern metal ceramic and metal-free prosthetics are useless due to shift and choose height. Stamped crowns are successfully used. There is no need for ablation of supporting teeth. Very low price, very low price. That's what I was talking about. To date, stamped crowns are the most affordable insurance and successful options for the pensioners and low-income people. Well, half crown. I think it's a not a good topic for this kind of crowns. Maryland Bridge is a good one, I think. What is this? It's a non-removable part of the denture that covers the tooth from the palatine lingual surface, leaving the tooth vocal side open. It's used as a bridge support for the bridge, as well as for splinting of the front teeth. Um, when and why we should use such um, prosthetics? For example, when we have to remove teeth, to extract the tooth uh, because of inflammation, and we cannot place an implant um, at that place immediately. Um, when we try and how we try to work nowadays, usually we cannot place implants and make a temporary one crown on it because of a huge defect of inflammation, cause of inflammation, and bone defect or soft tissues defect, and we have to remake. We have to build that bone. We have to remake soft tissues around the tooth, and it needs time. And patient doesn't want to wait that time without tooth. If we're talking about front group of the teeth, for example, tooth number 11 or 12 or 21, 22, we're talking about smile line, we have to make something temporary like this. Yes, it's easy to make impressions or to scan the defect and to make a temporary one crowns like this, which gonna glue with these small pieces on the right side, left side, um, to the crowns, which situate close to the defect. Okay, the first half crowns in various modifications appeared at the beginning of the 20th century. Basically, half crowns are used as the bridge support of the bridge prosthesis in the anterior and lateral teeth. It's possible to use a certain number of half crowns made a monolith for the securing the supported teeth during periodontitis. Half crowns are contraindicated in the presence of a sufficient defect on the proximal surfaces of the supporting teeth with insufficient height of the crowns of supporting teeth, with pathologically movable teeth, is bridge support of a large length bridge. In the manufacture of miscellaneous alloys for the cast in place non-removable. Prosthetics are used which can be noble and semi-precious stage of making semicrystals. Examination of the patient and determination of indications. Preparation of the supporting tooth or teeth. Receipt of the print. Manufacturing of a semi-crowns or half crowns in the laboratory. Fit the metal frame in the mouth. Fixing the prosthetics on the cement. Inspection, examination of the patient are traditional and conducted according to general accepted principle using the both methods. Okay, the next page, talking about plastic crowns already. Actually, we need to talk um, about crowns in general to explain when and why we have to use them, and all that crowns, stamp crowns, plastic crowns, one-piece crowns are not uh, using too much nowadays. Why? Because nowadays we have a lot of modern kind of treatments like ceramic crowns, metalloceramic crowns, zirconium crowns, porcelain crowns also. So, when defects of hard tissues of the tooth crown, which cannot be replaced by sealing or using tabs, use different types of artificial crowns. Steering crowns restoring the broken anatomical shape of the natural crown of the tooth and supporting, ensuring the fixation of the bridges. That's what I say. What I said before about defects of the crown. When we cannot remake um, therapeutically um, broken part of the tooth, because it consists more of the 50 process the defects. For example, crown of the tooth and half of it broke. We cannot place composite there and to remake it just using just composite, because it's going to be half of the crown of composite. And what does it mean? It's mean when patient gonna bite something, he can broke it, he can get fracture, and usually that fracture not gonna be on the line between composite and tooth tissues. It's always taken with it a big part of the tissues of the tooth. And in the end, you have to extract the tooth, especially if a line of the fracture going deep, deeper than the line of the gum. And we have not the situation, that's a clinical situation, which we call we have special word for that. That's part of the tooth which is upper. I hope I'm gonna find it later in my lecture. For example, if tooth gonna broke deeper than the line of the gum, it's a very difficult to remake it because of saliva, because of bleeding, and we cannot put glue composite there because it's not going to be dry. It's going to be wet because of bleeding, because of blood, because of saliva, and if it's wet there, it will never glue. It with a very nice composite. And that's why we have to extract the tooth and to place an implant there, and later we have to place a crown on that implant. But we have if the that's broke line of the tooth higher than gum, yes, higher. So saliva and blood not gonna be a problem for us. We can place a coffer dam or rubber dam there to close the defect, yes, and directly to work with it by placing composites and later gluing composite and later placing crown on it. According to the design, crowns are divided into full, cultic semi-crowns, equatorial, telescopic crowns with a pin jacket finished. Depending on the material, metal crowns allow the noble base metals, non-metallic plastic porcelain, combinate, metal lined with plastic porcelain are distinguished. So, in turn, metal crowns are divided according to the manufacturer method by parts, made by casting from metal in the prepared forms and stamped, obtained by stamping out of discs or sleeves. Since artificial crowns can have a negative effect on both the periodontium and the patient's body as well when choosing their type and material, the patient should be carefully examined. Carefully examined. What does it mean? For example, if your patient have allergy of metal, you should never make such crowns for him. If your patient cannot have not only allergy, have chronic disease like chronic inflammation of the gum. I'm talking about disease, dental disease, yes, not general one. Chronic inflammation of the gum or chronic inflammation of the teeth, like pulpitis, periodontitis, parodontitis also. You should never make prosthetics for him before therapeutic treatment, before the preparing teeth for the prosthetics. Um, you should not make any impressions for them. You should never do the scans and even temporary crowns. First of all, you have to prepare your patient with professional hygiene, with plumbing defects, caries, cavities, also, and what else? If patient have a problem with moving of the teeth, you have to glue it to make sheen for it. Yes, and all left of that to think how to cover it by crowns. Okay. Since artificial crowns can have a negative effect on both of the periodontium and the patient's body as a whole, when choosing their type and material, the patient should be carefully examined. Indication for the use of artificial crowns. Destruction of hard tissues of the natural crowns as the result of caries, hypoplasia, or caries, hypoplasia, abnormal abrasive, wedge defect, fluorosum also. Not eliminated by filling or insertion. Anomaly of the shape, color, and structure of the tooth. So, I was talking a lot about structures, but of course, you can use crowns for aesthetic results. Yes, for example, the patient have an anomaly of the shape and color of the teeth, of the front group of the teeth, and a patient can come to you to a cabinet or clinic and ask your doctor, please, I want to change type, shape of my teeth and color of my teeth, and what can you recommend me? And nowadays, the most famous method to change a smile patient is of course is veneers. Yes, veneers nowadays is very famous, and I think you can find everywhere, in every clinic such a method is using. And but you should not, as I said, place any crowns or veneers on them teeth which have a defect like caries, hypoplasia, like structure. Uh, okay, let's continue. Restoring the anatomical shape of the teeth and the height of the lower third of the face for abnormal abrasion. Fixing bridges or removal dentures. What does it mean slower third part of the face for abnormal abrasion. When we extract molars and premolars because of complications of caries for the patient, what we can get later. We can see how the third part of the face, let's call this first part, second part, and third part. Yes, lower part of the face um, get a bit less. Yes, why? Because patient after extraction of teeth um, getting a lot of problems with occlusion. Yes, and that occlusion is going less, and when occlusion going less, third part of the face of the patient going less too. That's why you can see aesthetic problems like this, is skin latent patient here, and how to treat the situation. What is the treatment? Treatment, of course, is prosthetics. Yes, prosthetics on the implants. Yes, to place an implants and to make crowns and bridges later in it. Or if you're talking about abnormal abrasion, then it is less than it should be because of abrasion. They have to remake it and to make their form normal again, to make them high again by crowns. What else? Splinter with periodontal disease and periodontitis. Temporary fixation of orthopedic and orthodontic devices. Divergence or extension of the teeth if necessary by their considering breeding. You can place one-piece crowns when you're using devices for orthodontic treatment, and their crowns gonna glue that orthodontic device to the teeth for the period of the treatment. So it's working. Temporary fixation, of course. So that is what I want to say. We still have time, and what I can add after all of this. Nowadays, a lot of these crowns are not using it. Metal stamped crowns, plastic crowns, using just as a temporary for the temporary treatments. One-piece crowns are not using too much. Nowadays, using a lot of metalloceramic crowns, zirconium crowns, and porcelain crowns. What the difference? Now is a period of them of the prosthetics when we are not using too much impressions, and we are using scans. Yes, scans and computer design of prosthetics. And nowadays it's better. We can get a good result, and faster than before, because before, when we ask in our laboratory to make metalloceramic crowns after impressions, it takes like 1 week. Yes, 1 week minimum to make that metal carcass, and to place and ceramic on it, and it's time to polish it later. When we're talking about zirconium crowns nowadays, after scan of the teeth, it needs just few hours to make a crown. Few hours and 1 week. Of course, zirconium is better when you're talking about period of treatment and rehabilitation. I want to say like always in every situation, you have to think about protocol um, of the treatment. What does it mean, protocol? Protocol consists of a lot of things, but first things is examination of the patient. You have to ask your patient about many things: his age, where he's working, about his chronic diseases, about allergy, about medication, if he's taken any kind of medications, and a lot of things also. And all of this you have to write on your medical documents, medical card of the patient. It's of course very very important information. Later, you have to check on his body. And remember, I told about this third part of the face. And when patient just come inside your cabinet or clinic, you already can see such problem, and it's already giving you some information about his problems. Maybe it's problems about because of losing teeth, or that problem because of abnormal abrasion, and it needs your help as a prosthodontist. Um, you have to check on the color of the skin. You have to check on the lips. You have to check on upper jaw, lower jaw. Check on all the teeth. Check on carious cavities, pulpitis, periodontitis. Check all the parodontitis, and to check on maybe moving of the teeth. What else? You have to do X-rays for the patient. What kind of X-rays? Panoramic X-rays, computer tomography, and all of these gonna give you a lot of information to prepare a very nice plan of the treatment. So the examination is already half of the treatment. Not half, of course, but the very big and important part of the treatment. What else? After examination, you have to do a photo protocol. What is it? What is it? Photo protocol. You have to make a lot of photos of the teeth of the patient, of the face of the patient, and all these photos gonna give you a lot of information, because when you examine the patient in your clinic with the instruments, you can see many things, but we can maybe you're not going to find all the problem, but later when you check in the photos when you did before, you can find something else, and of course it's going to give you more information how to help that patient, and what kind of treatment is going to be better for him. Okay. After doing photo protocol, you have to send all that photo to your laboratory and to give your technique all the information about the patient, and it's going to help him to make a good form, good type of them and shape of the teeth. And as I said, when talking about prosthetics for them, molars, premolars, and frontal group of the teeth, you have to check on the bite, yes, bite of the patient before, and to understand what kind of the shape should be normal in the situation. Because, for example, if you're doing veneer, you want to place veneers on the front group of the teeth, and you didn't remake occlusion from pathological to the normal occlusion, and your patient has a deep occlusion, what does it mean? Your patient gonna broke your new veneers, which you just place him very very fast, maybe in 1 week, in 1 month, in few months, but you're gonna broke it because you didn't think about remake molars and premolars, and to make a normal high of the occlusion before making anesthetic treatment. It's a mistake. That's why we have to go to the back to or go back to the examination of the patient. Okay, so protocol: examination plus X-rays method examination plus photo protocol plus, if you have in your clinic, it's scan, face scan, and only after that you have to prepare for preparation of the teeth. Only after that.